Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is October 10, 2025. This video is on two articles. One original article titled Efficacy and Safety of Baxdrostat in Uncontrolled and Resistant Hypertension. And the second is an editorial, accompanying editorial, titled Aldosterone Synthase Inhibition for Hypertension, both published in the New England Journal of Medicine on the October 9, 2025 issue. Aldosterone dysregulation is a key driver of resistant hypertension. Baxdrostat is a selective aldosterone synthase inhibitor with once daily dosing. This is a phase 3 randomized double-blind placebo-controlled multi-center trial. 794 adults were included. Adults with uncontrolled hypertension, systolic blood pressure 140 to 170 millimeters of mercury on 2 drugs, or resistant hypertension, more than 3 drugs including diuretic. Intervention, Baxdrostat 1 mg, 2 mg or placebo daily for 12 weeks. The primary endpoint, change in seated systolic blood pressure at 12 weeks, stratified by hypertension type and baseline systolic blood pressure, analysis by ANCOVA, baseline systolic blood pressure as a covariate. What did they find? Systolic blood pressure changes at 12 weeks. 1 mg was associated with a 14.5 millimeter decrease, 2 mg with a 15.7 millimeter decrease versus a 5.8 millimeter decrease with placebo. Placebo-controlled differences, minus 8.7 millimeters of mercury with 1 milligram and minus 9.8 millimeters of mercury with 2 milligrams, p-value 0.001. Systolic blood pressure less than 130 by millimeters of mercury in 39.4% of those on 1 milligram, 40% with those with 2 milligrams, and 18.7% in those with placebo. Adverse events, hyperkalemia 2.7 to 7.9%, hyponatremia 0.8 to 2.3%, mild reduction in eGFR. Limitations of the study, limited ambulatory blood pressure data, underrepresentation of black and women patients. Key takeaways, Baxdrostat is effective in lowering systolic blood pressure in hard to control hypertension. Safety profile acceptable with mild to moderate lab abnormalities. Reinforces the role of aldosterone synthase inhibition in management of blood pressure. The accompanying editorial discusses these findings and concludes that this highlights durable blood pressure control, aldosterone breakthrough mitigation, and natriuretic synergy in salt-retaining hypertension. The key takeaway from the editorial is Baxdrostat may offer a novel, well-tolerated mechanism-based strategy for resistant hypertension with long-term promise. Eponyms behind aldosterone syndromes, Bartter syndrome, Dr. Frederick Bartter, NIH, 1962, described hypokalemic alkalosis with increased renin and aldosterone but no high blood pressure. Gordon syndrome, Dr. Robert Gordon, Australia, 1970s, familial hyperkalemic hypertension with low renin and aldosterone. Little syndrome, Dr. Grant Little, Vanderbilt, 1963, described inherited hypertension with sodium channel overactivity, low renin and aldosterone. Geller syndrome, Dr. David Geller identified gain of function MR mutation mineralocorticoid receptor mutation causing pregnancy-induced hypertension. Cohn syndrome, Dr. Jerome Cohn, 1955, classic primary aldosteronism causing hypertension with hypokalemia. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.